Local 4 News starts now with a breaking news alert.
Breaking news tonight as the state announces 10 new cases of coronavirus in Michigan, bringing the total now to 12.
Let's listen in. The governor is speaking now about it.
Presumptive positive cases in Michigan. We had 2 yesterday. We are at 12 today. We expect more to come. We are taking these cases very seriously and will continue to take every step to mitigate spread of the virus and keep Michiganders safe. In an abundance of caution, I am ordering the closure of all K-12 school buildings in Michigan for 3 weeks, starting Monday, March 16th, until Sunday, April 5th. This is not a decision that I make lightly. A lot of districts have taken action and already closed themselves. And my fellow governors across the country, on both sides of the aisle, have ordered the closure of their schools as well in a number of states. This, we feel, is a necessary step to protect kids and teachers and families and our overall public health. I believe that school employees should continue to be paid as though schools are still in session. I know this will be a tough time for our parents and educators, and I urge businesses to do everything that they can to support employees at this time. Some parents will need to stay home with their children, and not every parent will have the ability to do so. Not every parent has paid leave, though I think they should. So businesses must step up and provide help if their employees need it. We are doing everything we can to ensure that our families have the support they need during school building closures. And we are working with our local school districts to provide guidance and help children who need it access food during this time. Our number one priority is keeping our families and citizens safe and healthy and mitigating the spread of this virus. Please do your part. Make smart choices during this time. Even if you feel healthy and are asymptomatic, you can unknowingly be carrying and spreading the virus. Assume that you are, and take these orders seriously to keep yourself and your loved ones, your coworkers, and people at risk of serious illness. Again, there are easy things that every one of us can do to lower risk in our state. Wash your hands often with soap and water and vigorously scrub them for at least 20 seconds. Practice touching your face less often. Replace handshakes with elbow bumps, and cover your mouth when you cough or sneeze. I understand that what we are announcing today will prompt a lot of questions. We're going to do our best to answer as many as we can tonight, but there are some questions that we need to spend more time to work to get through. I ask you to bear with us as we work through to ensure the most accurate answers at the earliest possible moment. This is going to be hard, but we're going to get through this, and we're going to get through it together. Michiganders are tough. We stick together. In regard to the state workforce, I will be making a statement in the coming days. And with that, I'd like to hand it over at this time to our Chief Medical Officer, Dr. Janae Caldoun.
Thank you, Governor. Today, we learned of 10 additional cases of presumptive positive cases of COVID-19 here in Michigan. This brings our total number of presumptive positive cases in the state to 12. These cases were tested in our state laboratory today. They include an adult female from Ingham County with a history of travel on a cruise, 2 adult females from Kent County and 1 adult male, all with a history of international travel. An adult female from Montcalm County with history of international travel. 2 adult males from Oakland County, 1 with no travel history and 1 with a history of domestic travel. An adult.
All right, we're going to jump in here at this moment. We'll continue to stream this on clickondetroit.com, and of course, we'll continue to follow everything that's being said. But the patient that was just mentioned there is one that's gotten a lot of attention here tonight.
Yeah, because of the local transmission. This one did not travel. Is that right?
Yeah, exactly. I mean, I think we should hone in on the Oakland County cases. So right now, there are 3 cases that have been described in Oakland County. Previously, there was 1 female who did have a history of international travel, and tonight they described 2 males. 1 male had a history of domestic travel, but 1 male had no travel history, which implies that that might be related to local transmission within the state of Michigan. Now, the one thing they did not disclose, and I did actually contact the state to ask specifically, is whether that individual who had no history of travel had any contact with any of the other local COVID-19 cases. They basically said that they could not comment on that, but I think that they would have if they could have, in the sense that if it was, they would have said so. So I would surmise at this time that 1 Oakland County patient that did not travel may very well be evidence of local transmission at this point, which changes everything. Now, if you look also, there are domestic travel cases that they've described. 1 in Oakland County, 1 in St. Clair County, 1 in Washtenaw County, and 1 in Wayne County. All of those 4 patients traveled domestically, that is, they traveled within the United States. The implication is they may have acquired the infection somewhere in the United States. However, there's really no proof of that, meaning they may very well have traveled somewhere within the United States, come back and still acquired it locally. So the fact that they had domestic travel does not exclude local transmission either, but almost certainly the single Oakland County case, unless they had direct contact with an Oakland County or a Wayne County positive COVID-19 patient, that's local transmission.
Fair amount of frustration that we're hearing and seeing online, emails from people. We're not getting very much specific detail about the locales, of the cities in which these patients live. Other states are doing that. Have you been told anything about why we're not getting that?
No, I haven't, and I contacted the state about that, and really they're being, I think, cautious about releasing any patient information because they're trying to protect patient privacy. But honestly, again, I've said it in the past. I think releasing the city that they're in is a reasonable thing. I mean, we found out today that the Wayne County case was from Livonia, and we found out from the mayor of Livonia based on a tweet. And I think they may have done that because they were planning on closing Livonia schools specifically already. That is prior to the governor's announcement just now. So, you know, hopefully more information will be coming, and hopefully the state will change their policy on releasing the city as well as the county that these individuals reside in.
Got a lot of people concerned with that. Okay.
Yes.
All right, Doc.
Thank you.
Let me quickly, in case you're just joining us, get back to the headline of the night here, though. Michigan schools, along with these new cases, the announcement just happening now, Michigan schools, K through 12, being shut down starting this Monday, which is March 16th, and basically it's going to amount to a 3-week spring break for a lot of kids, running through Sunday, April 5th for all schools in Michigan.
So much to figure out with that, and a lot of kids go to school, and that's the only time they have healthy food to eat. How are they going?
Yeah, not the least of which to figure that out, too. Beaumont Hospital announcing tonight it has established a coronavirus hotline and putting controls in place to try to minimize people in their hospitals.
Mara McDonald is in Royal Oak, and Mara, tonight you spoke with one of the top doctors at the hospital whose specialty is infection prevention. What'd they say?
Well, Kimberly, he's got some good advice. We're going to get to that in a minute. Number one, if you have a loved one at any of the Beaumont hospitals, starting tomorrow, when you hit the door, you're going to be screened, and they're not going to allow everybody to go in. They're trying to minimize the risk to the patients in the hospital and to their staff. Take a look.
Our hospital, our job is to take care of patients.
And right now, Beaumont has determined that means minimizing the traffic coming in and out of their hospitals.
We're minimizing that risk for our patients, for our families, and for our healthcare workers. We want to keep them healthy so that they can provide the care that they need to provide to the patients when they need it.
If you're worried you have coronavirus, they want you to call their hotline, staffed by nurses who can talk you through your options. What they don't want is the so-called worried well people jamming the ER. People who do that take critical services away from people who are having things like heart attacks, strokes, and other truly emergency issues.
I think we got to be very mindful of mass gatherings right now.
And if you do decide to self-quarantine because you're elderly or have serious underlying health issues, that doesn't mean just going to Costco once a week. It means staying put.
Self-quarantining really means that you should be staying home. You should be practicing infection prevention precautions in your home, hand hygiene, avoiding others.
If you are in good health, wash your hands thoroughly.
I'm going to go to the stores. I'm going to be safe. I'm going to use common sense when I'm out and about. That's what I'm going to do.
Back here live. In other words, don't panic. There's no reason to hoard stuff. If you are healthy and young and able to go out and go to the grocery store, just practice distancing and wash your hands. Another note, if you do have loved ones in any of the Beaumont properties and they are in end-of-life care, the hospital will, of course, make some accommodations to help those visitors out. If you want to call that coronavirus hotline that Beaumont has set up, if you're worried about symptoms, all you have to do is get on our website, click on Detroit.com. Number's right there. We're live at Beaumont and Royal Oak tonight. I'm Mara McDonald. Back to you.
Good common sense advice. Okay, Mara, thanks.
Day of extraordinary developments in so many different ways. We've got much more to come here tonight. Back with more in just a minute.